Does testosterone replacement therapy increase a man's risk of heart disease, some sort of cardiovascular event, stroke, whatnot? And this has been a long time question that has been plaguing the medical world well over a decade now. Those of us who are into CrossFit and certain types of fitness programs know that keeping healthy and using testosterone therapy helps to reduce the so-called metabolic syndrome, which I won't go into quite detail now, but it helps with insulin production, insulin receptivity, among other things. But nevertheless, this has been an ongoing debate. And finally, this past summer, around June and July of 2023, the Endocrine Society and a multi-center publication in the New England Journal of Medicine has finally put the issue to rest once and for all. So here it is. What they found was, I'm looking at some notes here, using about 5,200 men after a mandate was made basically by our government in 2015 of basically this has to be researched and we've got to come up with an answer. So using 5,200 men with a randomized prospective study using 1.62% of testosterone gel applied daily and using a testosterone therapeutic range between 350 and 750 in men who were in the study between the ages of 45 and 80. What they found was magically there was no increased risk of any heart disease or stroke. So there you have it. The study is done, multi-center, prospective, randomized, large range of men, large study, 5,200 men. There you have it. There's no increased risk. Now, incidentally, funny enough, what it did show, and they don't really quite understand why, was the incidence of atrial fibrillation, an abnormal heart rhythm, went from 2.4% to 3.5% in men off versus on testosterone replacement therapy. And a kidney injury of some sort went from 1.5 to 2.3%, and a pulmonary embolism or a blood clot in the lung went from 0.5% to 0.9%. Now, these numbers seem to be very small change, I would agree. Statistically, however, because of the research protocol, these were statistically significant increased risk of atrial fibrillation, an injury to the kidney, and a pulmonary embolism. But again, it was very low numbers, 2% versus 3%, 0.5% versus 1%. So they don't really understand it. Personally, I think the study was great. I see no reason not to be on testosterone replacement therapy, as it has no increased cardiovascular risk, but the benefits of testosterone replacement therapy go through the roof, and we all know that. So there it is. There you have it. End of discussion. I hope this helps.